For decades, we were taught that patients had to be fasted prior to procedural sedation in order to avoid vomiting and subsequent aspiration. Much of this was extrapolated from the anesthesia world, but what they do in the operating room is very different than what we're doing in the emergency department. Our procedures aren't scheduled, and there's a certain immediacy to getting them done that forces us to avoid any delays. In addition to that, the concerns about vomiting and aspiration in ED procedural sedation are unfounded in the literature. ACEP issued a clinical policy in 2018 trying to clear all of this up. They state the literature does not support a significant association between fasting length and incidence of adverse events in adult or pediatric patients. The urgency of the procedure dictates the necessity of providing sedation without delay, regardless of fasting status. All that being said, there are some things to take into account in the patient who truly has a full stomach. Number one is to consider if the procedure truly is an emergency or if there can be a slight delay. Number two is that we can give the patient an antiemetic to reduce the risk of vomiting. And finally, number three, we can consider altering the sedative we're going to use to preserve airway reflexes. Overall, we do not need to fast patients prior to ED procedural sedation and analgesia, and remember that it's the immediacy of the procedure that's going to dictate whether we wait or proceed immediately.